Madison County, way over in eastern Idaho. It's the home of BYU-Idaho. Maybe 40,000 people scattered across 473 square miles. Madison County has made national news of late for its COVID cases. It's a hotspot, not just for Idaho, but for the entire country. Madison County, not even in the top 10 for population in the Gem State, is in the top 5 when it comes to confirmed coronavirus infections. Over the last 7 days, they've had an average incidence rate of nearly 181, meaning for every 100,000 people, they've had almost 181 cases. A month ago, they were at 20. Nobody else has even come close across the state of Idaho. This week so far, they've had 258 cases. That's more than Ada County. Well, today we spoke with Dr. Kenneth Krell. He's an intensive care specialist at Eastern Idaho Regional Medical Center in Idaho Falls. They are the referral hospital for that part of the state and surrounding areas. And lately, a lot more have been coming in from Madison County. Dr. Krell has been at ERMAC for nearly 40 years, and he's seen health crises before. He was there for H1N1 in 2009, even contracted it and developed a rheumatoid disease because of it. This spring, he stopped taking his immunosuppressant medicine just so he could care for COVID patients. That was also about the time he started writing op-ed pieces for the local paper. He's written several of them because, as he told me today, he feels like when he sees something, he should say something, to try and reinforce the realities of what the pandemic looks like from the healthcare side of it. So what has he seen lately that led to publishing his opinion piece yesterday? COVID-19 is much more dangerous than the community recognizes, he says, and the younger generation has become a bigger concern.
The most alarming increase in cases has been in the 18 to 39-year-old group, who also seem anecdotally to be the group most flaunting recommendations, including masking, distancing, and meeting in large groups. In that group of the 18 to 39-year-olds who see themselves as invincible and right now comprise our highest group of individuals getting infected with COVID, at least 1 in 5 to 1 in 3 of those still have severe symptoms after several weeks.
What is it like right now at your ICU?
We have right now about half a dozen ventilated patients, and it varies a little, but that's about what we've been running, sometimes more, sometimes a little less. And that then represents kind of the tip of the iceberg for our region in cases who have become critically ill. We also have about 30 cases on the wards of patients who are just requiring oxygen, but not requiring intubation and ventilation.
Okay.
In addition, though, I think it's important to understand that we are nearly at capacity, not principally because of COVID, but because of the other diseases that we're seeing, the traumas, the burns, the critically ill medical patients. We have to remember Idaho has a very low rate of ICU beds per population, one of the lowest in the country. So it is easy for us to get overwhelmed in terms of resources, not just those physical beds, but in terms of staff.
You've been working there since 1982.
Yes, I have.
Have you ever seen anything like this in your time?
No, and I hope I never do again. No, we have not encountered anything like this. The closest we came was H1N1 in 2009, but that was a very different epidemic of influenza. I had a whole ward full of pregnant women on ventilators, and we had a lot of pediatric cases. Those groups seem to be relatively spared from getting severe disease now with COVID. It's a different disease hitting a different portion of the population.
Comparing this to H1N1, you've already done that a couple times, but when it compares to how you're seeing it affect your patients, what's COVID been like for you?
It's been awful. One of the things is given the infectivity of patients dying alone, of not being able to be surrounded by their family members. And we believe family in our ICU is very important and an integral part of the team. And we're devoid of that now. We're unable to have family members there. So we see patients struggle for much longer than any disease process I've ever seen. But watching the severity of illness in these patients, how difficult they are to ventilate, their very high mortality, While we've improved mortality from probably 80% of patients who end up on ventilators, we're no better than about 50%. So I know every time I intubate a patient and put them on a ventilator with COVID, I've got a 1 in 2 mortality risk for them. Madison County's death rate will undoubtedly increase, however, as that low-risk group secondarily spreads cases to the more vulnerable population over the next several weeks. I find it perplexing that the age group who leads the way in other areas of social responsibility, such as climate change and equality for all individuals, regardless of race, can be so cavalier about their most immediate challenge, that of protecting the entire community, including the most vulnerable among us.
That's a pretty poignant paragraph.
That's the point I want to get across to them. Yeah, they're responsible in other areas. They're concerned socially in other areas. They've got to see this as their most immediate social concern at this point.
I guess going forward, what do you hope for?
I hope for us to buy time by being socially responsible for us to get out of this mess. And we will get out of this mess.
Have you gotten any backlash from your editorials, or what has been the reaction?
I get lots of backlash, yes. But I don't take it personally. I think that we all come at this from a different perspective, and I just want people to be able to see healthcare workers' perspective and to not see this as some kind of political issue. This is a public health issue. This has nothing to do with our individual freedom. It has to do with our collective survival.
Dr. Krell is 70 years old, and he shares his ICU duties with just one other doctor per shift. And he says he's let go of the administrative roles he used to have over the years and doesn't work as often as he used to. But at an age when most people are thinking about the next chapter of their lives, he's still doing it because he loves it. He loves taking care of patients. He just wishes there weren't as many of them right now.